California is considering new regulations for a recreational marijuana industry that now includes more than 1,500 retailers. The idea is to put health warnings on cannabis products like the labels on cigarettes, and some will address the mental health risks from smoking pot. April Domboski of member station KQED reports.
For a lot of grandparents, your first grandchild holds a special spot in your heart. For Elizabeth Kirkaldie, that is Corey.
He was the sweetest little kid in the world. I had a very close relationship with him.
Corey was top of his class in high school and a talented jazz bassist. By the time he graduated, he was a serious pot smoker, too. And for Corey, pot didn't just make him paranoid. It also made him psychotic. He started hearing voices.
They were going to kill him, and there were people coming to eat his brain. I mean, weird stuff.
After high school, Corey came to live with his grandmother for a couple of years, here at her home in Napa, California. She thought maybe she could help. Now she says that was naive.
I woke up one morning and no Corey anywhere. Well, it turns out he'd been running down Villa Lane here, totally naked.
Corey was diagnosed with schizophrenia. His grandmother blames the pot.
The drug use activated the psychosis, is what I really think.
It's what many psychiatrists think, too. Studies show people who use cannabis are 4 times more likely to develop schizophrenia. For people who smoke every day or use high-potency products, the risk is 6 times higher. Yale psychiatrist Deepak Cyril D'Souza says there are things states can do to reduce the harms.
Such as have limits on the amount of THC in products that are sold, have clear labeling about that so that people who buy it know what they're getting into.
That's exactly what California wants to do. A proposed law would require pot businesses to include warnings about mental health risks in their advertising and on product labels. They'd have to be set against a bright yellow background, use black font, and take up 1/3 of the front of the package. Opponents say this is excessive and expensive. Lindsay Robinson runs the California Cannabis Industry Association, which represents legal pot businesses.
The heart of the issue is that there's a massive unregulated market in the state.
Legal dispensaries turned over $1.3 billion in state tax revenue last year. On top of that, Robinson says they're struggling to keep up with existing regulations, and adding more requirements just makes it more likely that they'll go out of business.
The only real option if they fail out of the legal system is to shutter their businesses altogether or to operate underground.
Some people, even parents like Elizabeth Kirkaldie, are skeptical the labels will work. Her grandson Corey is stable now, living with his dad. But she's not sure a yellow warning would have stopped him when he was a teen.
They're just not going to pay attention. But if it helps even one person, great.
Doctors like Cyril D'Souza are optimistic. Regulation worked for cigarettes. Smoking among kids has plummeted in the last decade. He credits warning labels, education campaigns, and marketing restrictions. And he says applying the same health strategies to cannabis is long overdue. For NPR News, I'm April Domboski in San Francisco.
So crazy, it's like we never left. The Cows, Gusty Renegade, program 2 of 2 on Wednesday, July 20, 2022. So I have been told. So, in case we have folks who they just tuned in at our normal time and there was another program, I've been saying we were going to do our recap. We've been broadcasting for 13 years, so let us go back and revisit what were we talking about in 2013, back when in exactly 2 states recreational cannabis was legal. What were we talking about with regards to Dr. Frances Cress Welsing, medical doctor, who was with us at the time, who told us, hey, I have some concerns about this recreational cannabis use, and wow, like some of it, the dosage, some of the cannabis now is so much more potent that I've worked with clients, medical doctor, I've worked with clients where they're exhibiting symptoms of psychosis. Seems like it's a correlation with the cannabis. We talked about this in 2013. Many of our listeners were skeptical. Fast forward all the way to 2022. What did we just hear at NPR? Warning labels on cannabis. And in fact, they had, I guess maybe all things are timed correctly, in the LA Times, I shared it this past week, they had an editorial, legal pot needs better warning labels. They're talking about this exactly. And they even talk about, hey, the legislation currently got watered down some, but even that is a good start. One ode to Dr. Welsing, who again talked about this 10 years ago. And I told our guest for today, man, we have parents, like, forget all the other stuff. Like, we can quibble about, telling people about their individual liberties and all the rest of it. But I mean, hey, parents, people who have young folks that they care about, hey, listen up. We have cows listeners who are parents who have children where they said exactly what Dr. Frances Cress Welsing said, exactly what they said in California about why we need to have warning labels on these products. My child, whose brain is still developing as a teenager, my child is showing having mental health problems. And I think it's related to their use of cannabis. That should be more than enough to have serious, let's make sure that we're thinking about this, understanding some of these concerns, and having lots of great information to share with our children if we are parents, or even if you have nieces, nephews, cousins that you care about and want to make sure that they make great, informed decisions. Our guest for today's program, a pediatrician and public health expert who serves as senior advisor at the Public Health Institute. She coordinates their prevention policy group and improves PHI's portfolio of programs in prevention of non-communicable diseases in the world. She's been a big part of the effort to get the warning labels affixed to cannabis products in the state of California. So glad we could finally get her on the program with us. Joining us live, Dr. Lynn Silver. Dr. Silver, are you with us?
Hello, Gus. Can you hear me?
Yes, ma'am. We can hear you crystal clear.
It's a pleasure to be here with you this evening, and I'm so glad you're doing this segment. What can I do for you?
We have lots of questions. Let's see. For folks who are parents, I'll say at the beginning, go ahead, dial in. If you're a parent, do not wait till the last minute or what have you. Go ahead and get a hand up if you have questions to ask Dr. Silver, medical doctor. For our listeners, this might be, for some of them, their first time hearing about you and the work that you do at PHI. What is it that you do, Dr. Silver?
I work on preventing disease, on trying to change factors in our environment, whether it's food or physical activity or products that are dangerous, so that they're less likely to make people sick, keeping people out of the hospital. And when cannabis was being legalized in California back in 2016, we looked at the way it was being legalized and said, hey, even if you're in favor of legalization, it looks like we're forgetting everything we learned from tobacco and alcohol here, and maybe we should be a little more careful. So we started a project called Getting It Right from the Start, and it's been working on trying to promote public policy that can protect kids and protect youth and reduce harms from cannabis, even as cannabis is getting legalized. Because, some good things have come out of this. There's been a 96% reduction in people getting arrested for cannabis possession in California, and that's the good news. But just like nobody should go to jail, nobody should end up in the hospital either. And that's the part that we think has to be balanced, so you can allow legal access, but we have to make sure that the products are safer and people are informed and they understand the risks and how to use this more safely and who shouldn't use it, so that they don't end up in the hospital or with more serious health problems. Cannabis, most people who use it, most people get high at a party, they're going to be okay, but there is a significant minority of people who are not okay. And people need to be aware of that, and we need to try and prevent that. And the stories that you were just talking about, particularly about psychosis and schizophrenia, are some of the most serious and really worrisome ones associated with the way our cannabis market is evolving here in the U.S. and many states across the country.
Awesome introduction. Again, parents, the number 720-716-7300, the code 564-943 pound. Press star 61 if you would like to participate. So that's great to give some of your background in terms of getting it right from the start, in terms of how legalization was going to be approached in California. From what you said, it doesn't sound like you're opposed to cannabis legalization as such. Is that accurate?
Well, I definitely am in favor of decriminalization and not sending hundreds of thousands of people to jail for cannabis possession. My favorite approach would be what Quebec is doing, which is that they have a public monopoly that has stores and allows legal access in a nice, safe environment to cannabis, but it's not advertising, it's not pushing it, it's not trying to maximize, sales and make as much money off of it as possible. It's just trying to substitute that whole clandestine illegal market with a road pathway for legal access, but not one that's going to be seeking to maximize its profit. Because where we get into trouble is what I call the Coca-Colization of cannabis. When it goes from being a traditional botanical plant that maybe was 3 to 5% THC to being these highly industrialized, purified products in flavors like grape and vanilla and chocolate, or edibles, luscious, delicious edibles, or concentrates that are, 90% THC, and then all of a sudden it's a whole different ball game. I mean, Coca-Cola didn't cause much diabetes when they sold it in 6-ounce bottles, but then when they started selling it in family size, 24-ounce size, people started getting sick and getting diabetes. And same thing with cannabis. If you turbocharge it, jack it up there, people start getting into more trouble. And that's what's happening. It always had some risks. Those risks are getting a lot worse.
Increasing risk. At least people should be informed about that. Why is it, you think, Dr. Silver, that the model that you mentioned in Quebec, which is not, hey, let's commercialize it, let's promote it, and try to make as much money as we can, why hasn't that model been promoted more widely?
It was used pretty widely in alcohol after Prohibition, and many states had, state alcohol stores, and 17 states still have some form of public alcohol monopoly, as do a number of Canadian provinces, and it worked. You had less binge drinking, less alcoholism in places that followed the alcohol monopoly model, and we're seeing similar findings in cannabis use in Canada with Quebec compared to other provinces, less increases in youth. It's not being considered more widely in the U.S. because the legalization process has been driven mostly by money, or maybe early on by idealists and true believers and people who were motivated by the belief in medical benefits from cannabis. But today, the major coalition that's pushing for federal legalization is funded by Altria Tobacco, one of the biggest tobacco companies in the world. And it's no longer, kind of long-haired farmers from Humboldt County or wounded veterans. We're talking about major industrial interests, including Constellation Alcohol, Altria Tobacco, and others, getting involved in the cannabis industry, looking greedily to its expansion, in part to replace falling sales from tobacco products.
Wow. We talked about that way back when, the tobacco industry, because lots fewer younger people smoke. When I say younger people, like 20s and under, lots fewer of those groups smoke today than previously. Like, hey, they could be totally saved if, THC becomes even more widespread. And 19 states in Washington, D.C. and counting. I have been trying to get information about this. Are you a parent as well, Dr. Silver, or no?
I am. I have 2 children and 3 stepchildren.
Wow, okay.
So 5 altogether.
Right on, okay, right on. Hard work being a parent. I've been trying to find out, do you know of any information with regards to risks for cannabis consumption for moms during pregnancy? Because that's one where I've asked, and a lot of people have just said, hey, there's not enough research done. I'm not sure. Do you know?
Oh, no, there's plenty of research.
Oh,
there's
let's hear it.
Quite a bit of research. One thing that's very clear is if you smoke cannabis during pregnancy, you're more likely to have a low birth weight baby. That is the same thing that happens if you smoke tobacco, and it's not a good outcome. And especially if you're talking about the Black community, I finished my pediatric training in 1986 and my public health training, and one of the biggest health disparities that we were working on, what is that? Oh God, nearly 40 years ago, was Black-white disparities and low birth weight and premature babies, and that problem hasn't gone away. It's still there. So we risk exacerbating areas that are already causing significant health inequities like low birth weight. If cannabis is used more widely during pregnancy, the other area of effects that's very concerning in addition to low birth weight is that the National Institutes of Health has this major national study looking at cognitive development of U.S. children. And one of the first publications looked at 11,000 kids who were age 9 and found that the 7% or so who had been exposed to cannabis while their mothers were pregnant had a series of developmental issues, some early signs of psychosis and other neurological and psychological changes that were quite worrisome. So that is evidence that there may be long-term harms to children who are exposed in utero, in addition to the risk of low birth weight. The risk of low birth weight was one of the findings of the big study review done by the National Academies of Science back in 2017. So it's pretty consensual. And a number of other papers have come out since that cannabis use is associated with low birth weight. So there's no question women should not use it when they're pregnant. They should not use it when they're breastfeeding. And yet, there was one study somebody did, they called up all the dispensaries in Colorado and pretended to be a pregnant woman who was nauseous and asked what they should do, and 2/3 of them recommended that they, use pot to treat their nausea. You absolutely should not do that. The American College of Obstetricians and Gynecologists says do not use weed when you're pregnant or breastfeeding. And that's one of the warnings that we're trying to make much more obvious and clear to people in the California bill that you were talking about.
The breastfeeding, that's so important. Being mom is such a important job. That is, being the best mom, breastfeeding. Like, I forgot all about that. When you consume THC products, that does go to the breast milk. Wow. That's
goes
why.
Straight to junior.
That's why it's so important to talk to medical professionals, medical doctor. Wow, now I feel kind of foolish because I was going to ask, because I've heard that. People say, well, what about morning sickness and being able to use something with THC to get the mom to be able to, get a little bit of nourishment in during that time period. But wow, if there's how widespread is this risk, Dr. Silver, for low birth rate and then maybe developmental delays for the offspring once they're born? Is this widespread, or is this very low risk?
Well, what we've seen in California is that use of cannabis during pregnancy has almost doubled. So in 2009, it was 4.5% of women reported using cannabis during pregnancy, and a decade later it had gone up to 8%. So with all the marketing and the hype about cannabis being a wellness product, a lot of women are thinking that it's a safe, natural product that they can use during pregnancy, and it absolutely is not. So there's just a lot of misinformation out there, and that's very worrisome. I don't think we have good data to say, what percentage of low birth weight cases in the nation are due to this problem yet. But I prefer to just really get the word out there. And, every pregnant woman should know, no, you don't use this when you're pregnant. It should be clear as day for anybody who walks into a dispensary. It should be really clear on cannabis products. It should be on every advertisement for cannabis, and it's not.
The cows, Dr. Lynn Silver, err on the side of caution for sure.
Right now in the state of California, the warning not to use when you're pregnant is in 6-point font. Sometimes it's hidden on the back of peel-off labels or some of them are inside the box. So you only see it if you buy the product and open it. Sometimes my favorite was a can of mints where you have to, I don't know if you've seen it on cosmetic products, where you have to peel off the labels to see the ingredients, and they're doing that for cannabis products too, and that's the only place you can find a pregnancy warning on something.
Wow, that's so tricky. With the, I was telling listeners.
Gus, can you still hear me?
Oh, yes, ma'am. Can you hear me? Can you hear me? I can hear you. Are you able to hear me? Hello? Hello? Can you hear me? Let's see. Can you hear me? Dr. Lynn, can you hear me? Let's see. Dr. Lynn, can you hear me? Listeners, are you all able to hear me, or am I not coming in okay? Let's see. We'll take a quick. I can hear you, Dr. Lynn. Let's see. Can you hear me, retired firefighter? Can you hear me, or am I not being heard? Let's see. Oh, it looks like I was. Can you hear me, retired firefighter, or
Gus? Can you be heard?
I can hear you. Can you hear me?
Hello. I got cut off for a minute there. Your voice just came back on.
What is going on?
This service is provided in high definition by... Access code accepted.
All right.
There are 14 participants in the conference. Q&A session has started. The recording has started.
Hello? Okay. Can I be heard now?
Yes. Okay.
Awesome. I don't know what happened. I was trying to get to my next question, and then my sound, I guess, wasn't being picked up. Much obliged to everybody for being patient and retired firefighter in Florida. I was saying before I got, I guess, whatever went down with my audio, the LA Times, I was telling folks they did that editorial this past weekend, and they were talking about the importance of Dr. Silver and all the folks that her cohorts that have been working to get legislation passed to make it very clear and no tricky marking with regards to the warnings and potential harm of cannabis consumption. The editorial, it said that they watered it down from what you originally proposed. What are some of the changes that were made to the bill as it's kind of worked its way through Congress in California?
Oh, yeah. So this bill, which we wrote and has been supported by California's pediatricians, obstetricians, gynecologists, emergency docs, psychiatrists, tons of people, LA County, originally would have required that a third of the front of each product be occupied by a rotating warning, a graphic rotating warning, so a picture and a short message, and that message would alternate between different issues like don't use during pregnancy, do not use when you're driving while highs, DUI, the risk of psychosis. This is the approach to warning labels that's used internationally now for tobacco, and that the FDA will be adopting effective next year on cigarettes. There's a lot of research that shows that these shorter, graphically illustrated warnings get people's attention, they retain the information better, it's more likely to work. And there have been a number of research studies done that show the same thing for cannabis, including one we did. So our original bill would have required these prominent rotating warnings both on products and on any ads. So if somebody stuck a billboard up in your neighborhood that your kid passes every day on their way to school, it would at least have a warning label up there saying, for example, use by youth can cause long-term harm, or some of these other messages, so your kid would at least get the other message. or your pregnant wife would at least get the other message. And then it would also have required a brochure with the warnings and information on safer use that would be provided to every customer coming into a retail establishment. So that made it through the California Senate, and then when it hit the Assembly, the cannabis industry woke up and mobilized and tried really hard to kill it altogether. They didn't kill it altogether, but they greatly weakened it. So what's left in the bill right now is a one-page flyer that all cannabis retailers will have to have in their stores and to offer, not necessarily to give, but to offer to all new consumers with information on safer use. But it does have to have the information on these key health risks, including psychosis and schizophrenia, driving, not using during pregnancy, risks of increased suicide risks with heavy use, and the risks of these high THC products. And it also requires adding to the product label warnings about mental health effects, but it did leave that to the discretion of the state agency. So our state agency is very much influenced by the cannabis industry, and I don't know whether they're just going to give some general mealy-mouthed statement about cannabis may cause mental health problems, or whether they'll be clear and specific in ways that will really get people's attention, like cannabis causes psychosis and schizophrenia, or its use of cannabis is associated with psychosis and schizophrenia. So that's what's left of the bill, but it's still an important bill because up till now the state hasn't acknowledged these problems. It hasn't recognized that cannabis can cause these serious mental health problems, and it really hasn't effectively countered the messaging of the cannabis industry that cannabis is this benign wellness product, even as, in fact, what the industry is doing is turbocharging the product so much that they've become quite a bit more dangerous.
Turbocharging. That's language. In fact, she had two there, turbocharging and mealy mouth. That is one of my favorite words in the English language. I look for every opportunity. Mealy mouth. I love it. I was going to ask, but I got paused there like, now, wait a minute. Dr. Silver, you said increased suicide. Now, wait, the evidence, increased suicide from cannabis?
Yeah. There was a lot of debate about it, but last year the NIH published a study they did themselves. The lead author was the director of the National Institute of Drug Abuse, Dr. Volkow. They studied over 250,000 people, and they looked at whether you were thinking about suicide, whether you'd made a plan for suicide, whether you'd attempted suicide. And they found significant increases in suicide risk even in people who did not have serious depression. And that risk was directly linked to the frequency of cannabis use. So the more often you were using it, the more likely you were to have these issues. So we talked to a lot of young people, a lot of teenagers who were sort of self-medicating with cannabis, thinking that this is going to help their stress, that it's going to help their anxiety, their depression in many cases. There is a significant amount of industry advertising out there saying you can treat depression with cannabis, which is not true. And in fact, what may be happening in many of these individuals is that they're actually increasing their risk of suicide. I think one of the most heartbreaking parts of the work I've been doing for the last 4 years is we've met with a lot of parents of kids who developed psychosis and went into downward spirals, developed suicidal ideation, attempted to take their lives, or successfully took their lives after starting to use cannabis heavily, and typically products like vapes and dabs that are very high potency cannabis. And they just tell story after story of this. And one of them is, a neighbor of mine in Berkeley, where I live. The support group for parents has grown enormously. There's a family, Bart and Hazel Bright, whose son Kevin developed severe psychosis and eventually took his own life. So, these were more anecdotal stories for a long time, but this huge study that the National Institutes of Health did really is firming up the evidence that there is a strong association with suicidality, and it's extremely worrisome. Our suicide rates nationally have risen a lot over the last few years. We don't know how much of that may be associated with cannabis use, but just like psychosis, these are such serious things. Why would we not be doing everything we can to prevent them and to alert people to the risk? Why would we not be regulating the cannabis market in ways that can make it safer and reduce the risks that use will cause these kinds of problems? Reducing the amount of THC in products, labeling to alert people to these issues, making the risks clear, limiting advertising and marketing or putting warnings on it so people at least know what they're getting into.
Wow. That would count as evidence, I reckon. Wow. I think it's also really important. I was telling folks we started out, so this is our second program of the day, and we revisited some of the content from 2013 when we talked about some of these very same issues. And I said, wow, I mean, it really was the movie, Back to the Future. Like, we went back in time. At that time, there were only 2 states that had legal cannabis. Now it's 19, Washington, D.C. And I said, man, like what you just said, dab, shatter. I don't even think that those products existed in 2013. And that was a part of the, hey, this is not. If you, consumed cannabis, if you're an older person, if you consumed cannabis when you were younger or in college, went to some parties or whatever and did or what have you, great. This is not the same cannabis. And even the way that people are consuming the product has totally changed. Like when you were, I don't know if people caught that or not, but you were saying they used a torch to heat the product, some of these different products. Can you talk, because these are the high potency supercharged products that we're talking about that I don't think all the folks are familiar with. This is not just crumbling herb.
You're absolutely right. I mean, I'm 64. So when I went to college, weed was, a plant that you rolled in a joint, and it was 3 to 5% THC. And some people still did have these problems of psychosis and other ill effects from it, but it was much less common, and they were much less likely to develop really addiction and daily use. Since that time, the flower, it's the weed for rolling a joint that's being sold in dispensaries now is between 16 and 30% more or less. So it's, 5 to 10 times as strong as the flower in the 1970s. And then there is this whole new industrial market of stuff that just didn't exist. So, hashish existed. There were some, physical ways of concentrating cannabis that people used historically. But now it's chemical extraction processes that make the liquid that goes into vape cartridges. It makes waxes and resins. It makes this brittle stuff that looks like broken glass that people call shatter that you vaporize with a torch and inhale. And that inhaled cannabis gives you a really, really high dose shot of THC. And vape and dabbing is one of the most rapidly growing ways of using, and it's also one of the most addictive and the most likely to cause problems because of this very high THC dose that people are getting. And there's, waxes and rosins and Rick Simpson oil and, a whole bunch of things that I had never heard of until I started working on this project that are out there. And then there's also edible. So, if you sell a can of beverage, it used to be that a can couldn't have more than a single dose. Now they're letting a can have the equivalent of a package or 10 doses in it. So the natural thing to do if you get an 8-ounce can of something is to, chug up the whole can. Well, take a look what's in it because it may be 10 doses of cannabis in that can in California, and other states may vary. So if you drank that whole can, you would be very, very, very stoned. The same thing with other edibles. And then, in case you didn't realize it, there's this whole other market that's let loose across our nation, which is hemp-derived products. And right now in many states, we're also seeing, even outside the legal cannabis market, products derived from industrial hemp. And industrial hemp is nothing but the same cannabis product with less THC in it. But the chemists go to work and they take that industrial hemp product and they turn it into exactly the same stuff, which is psychoactive THC products. And they sell it in smoke shops and vape shops that are not age-gated. So your 10-year-old can walk in there and buy a Rice Krispie bar with 300 milligrams of THC in it. So parents, be really aware of that. Warn your kids. Take a look at what's being sold in your neighborhood. It's going to take a lot of state and local action. I mean, I would recall the first warnings came out about cigarettes in 1950. We've been working on tobacco control for the last 70 years to try and reduce tobacco use. The cannabis market is just launching, and if we don't start to take action at the state, local, and federal level to make sure that it's a safer market, we're going to end up taking 100 years to fix this problem. So I really hope that people become aware of this, take action in your communities to make sure that if cannabis is being legalized, it's being done with a lot more attention to safety, to limits on products, to informing people, to limiting advertising and marketing, maybe even to just being available in a public monopoly store or a nonprofit monopoly store that's not trying to make as much money as possible.
What's your response to folks who say, Dr. Silver, that you're painting with too broad of a brush because people who consume flower, who, let's call it old school, who just consume the flower product, however they do so, that is vastly different from all of these high-potency products, the shatter and dab and everything else that you talked about, that, hey, I'm not using a torch for anything. This is the same old rolling a joint or whatever else, and I don't think that this should be subject. I don't think people should be thinking that just this alone is going to cause me to be psychotic or suicidal or having all these mental health problems. You would say.
So first thing, don't think anyone's saying that most people who use pot are going to become suicidal or psychotic. People say, oh, you're just going back to reefer madness. And there was, a history of racist and misleading characterization of people who use pot as they were immediately going to, flip out and become violent and, madness and so on. And that was never true. So most people don't have that. But a significant minority of people, maybe 10 to 20% of people who use pot may develop dependency. It's more likely if they start really young, and they may develop these more serious issues. But, when you're talking about something that's used by a large percentage of the population, 10 to 20% of them is still a very big number. You're talking millions of people. So it's not a small problem. It's a big problem, even though, the majority of people who use pot will not have this happen to them. But they probably will know somebody that it's happening to if you ask around. So it's one of those things that's pretty frequent, but it's not affecting everybody. But just smoking a joint, again, as our former Surgeon General said, this is not your mama's marijuana. And that joint may be 5 or 10 times more potent. And so we are seeing negative effects, including psychosis, with just smoking flower. It's not, especially this new, more potent flower. So some countries have limited flower to 10 or 15% THC, and the U.S. has not. The states which have legalized have not. A lot of these harms could be reduced by backtracking on some of the changes in what's being sold that are making the problems more serious and more widespread. And we should do that really quickly. There hasn't been a lot of appetite for doing that. It's pretty amazing. The U.S. Senate, the NIH, All these very authoritative figures have all come out, the National Academies of Science, and said this rapid increase in potency is dangerous, it's going to cause harm, we need to do something about it. But really, very little has been done. New York and Connecticut are taxing by potency. Illinois as well, I believe. Connecticut has put some limits on it. But the work to really try and reverse this turbocharging is just starting. And we haven't gotten very far yet. The industry is moving so much faster, and when you try and do anything to protect public health, they come out and say, oh, anything you do, there's a big illicit market out there, there's a big bad illicit market, anything you do is going to favor the illicit market, you shouldn't do anything. But we just can't give in to that kind of logic. I think there is a big problem of an illicit market, but if we're going to build a legal market, we have to build a safer legal market for the long term, and one that people can use with as little risk to their health and well-being as possible. So people want to get high can get high, but they can get high with much less risk of ending up in the hospital. And there are ways to do that. It's not impossible. There will always be some risk, but there can be a lot less than our current cannabis market is exposing people to.
Wanted to nab some of our parents, see if they had questions for Dr. Lynn Silver, but I wanted to ask because just before you came on with us, I made the comment that we were revisiting 2013, back when Obama was in the White House and everything, and I said, I suspect it would have been hard for any of us at that time to envision that there would be basically now a 3-year global health pandemic that, from time to time would shut down jobs, school, all kinds of things, to where sometimes children, young people, might be stuck in the house for weeks at a time and got their dab and all the rest of it. And I just said, man, like all the reports that I've seen about the mental health crisis over the past almost 3 years now, and particularly for young people and all the stress that they've had, what is cannabis a factor in all of that over the past couple of years? I know that might be a lot to extrapolate. Do you have any thoughts, Dr. Silver?
The data seem to suggest that while use in adults continued to go up, and we saw a big increase in use by pregnant women in California during the pandemic, the national studies showed a decrease in youth use during the pandemic, and a lot of kids reporting that it got harder to get pot. So that was kind of a positive surprise that we saw that after that we saw that modest reduction in youth use. I think that was 2020 data or 2021 data from the National Monitoring the Future study of 9th, 10th, and 12th graders or something like that. But use in adults did not go down, and in fact increased in many places. And we've seen in adults in California, for example, a tripling of the percentage of adults who are using every day, and every day or nearly every day is kind of a red flag for the people who are likely to get in trouble with it. And that's really gone up a lot. But youth use, less so. But what we have seen with young adults nationally, not so much before the pandemic, was a really large increase again in the number of young adults who were using daily or near daily. And those are probably young adults who become dependent and frequently become dependent on high-potency pot, like vaping products, for example. So that group that is not just using, but using really frequently is a problem. So the pandemic seemed to have may have played out a little bit differently for adults than for kids. Kids weren't out on the street as much. They weren't in their schools. They weren't hanging out with their friends as much. So that may have had sort of the opposite effect for some of them. But they were very, very stressed. So we do have now, as kids are returning to school, and I work a lot. Some of my other work for the past year and a half has been setting up COVID testing programs in schools. I mean, but what we hear from the schools is they're less worried about COVID testing than they are about mental health because kids are coming back with major mental health challenges. And I'm guessing that as they come back, many of them are going to try and self-medicate those mental health concerns, after 2 years of pandemic stress with cannabis. And that may not be a good thing.
Wow, that is fascinating.
So we don't have the 2022 data yet, or that'll be coming in soon.
Fascinating. You again, as a medical professional, the brain is still developing right on into late 20s. Is that correct, Dr. Silver?
Yep, 26 or so. Your brain is pretty plastic. It's still learning its job and, finishing its organization and using substances before that age. I mean, the legal age is 21, but the brain age after which you should start, you should try and postpone use is really like 26, because that's when it's less likely to have more lasting effects on brain architecture and function.
That's the sort of thing I would encourage folks to really think about when we think about young people. I'm an old fogey, I speak for myself, but I mean people that are 25 and under. I guess she's an old fogey too, Dr. Silver. She told us her age already, but oh well.
I fessed up, yes.
Yeah, yes. But those out there who are young, spry, under 25, hey, you want to watch those risks for your brain computer. I mean, hey, that is the investment. Like, you do not want to take a whole lot of chances there, what have you. Protect that at all costs. That is something to kind of keep in mind through all of this. Let's see. I think our parents who chimed in, if you had a question for Dr. Silver, last four digits 9029. 9029. Did you have a question for Dr. Silver?
Greetings, callers and listeners. Gus, may I be heard?
Yes, sir.
I'm reaching out in regards to a lot of these. It's just a ton of questions, but I'll start with the first one, which is the same way that the tobacco industry targeted mainly the non-white community, specifically black. Do you see any signs of the same thing transpiring within the black community with quote-unquote marijuana?
I think we're just really starting to analyze that data. Where are the stores located? Where's the marketing going? And how is that happening? I've definitely seen targeting of gay and plus LGBTQ community with like specific products like rainbow sherbet, Pride, this and things like that. We've seen a proliferation of products that are marketed as blunts, which has traditionally been a product that's been used more heavily in the black community. So we've seen a lot of marketing of blunts and flavored blunts, and like grape-flavored blunts and all of this. Some of them aren't actually blunts in the sense that it's not a tobacco wrapper with marijuana inside. It's some other wrapping paper with marijuana because you're not legally allowed to combine tobacco and marijuana products and legal cannabis products. But they're calling them blunts and selling them as blunts. And we're seeing, I think we're going to end up seeing more advertising going on in low-income communities and communities of color, in part because more affluent communities often have restrictions on advertising, and advertising, can be concentrated in lower-income neighborhoods. That's what we've seen with everything, but the data is just starting to come out there, and we're just analyzing now the data on where did dispensaries and other businesses set up in the case of California, and are they targeting communities of color? So we're just analyzing that. We do know that, how many dispensaries there are near your home makes a difference how likely you are to use. So we just published a paper on pregnant women, and, the more dispensaries there were within a 15-minute drive from a pregnant woman's house, the more likely she was to use. So where those stores locate really matters to what population use ends up looking like. If they're all in the community color, that community and those kids are going to be more likely to be using.
Got you. I understand. Now, the second one is in regards to you and Gus were actually getting into it a bit more, but in regard to the brain effects, have there been any regulations that are specific towards certain states? Because I'm here in the New York City and the tri-state area. Literally within the last 2 months, I've noticed when I travel on the New York City public trains that now there are advertisements stating, be mindful of smoke and its harmful effects with people that are around you that may not smoke. Or they'll say something to the extent of, if you're underage, you shouldn't be smoking. And these advertisements are literally brand new. I mean, I've been riding the train throughout the whole entire pandemic, everything. And these advertisements just started maybe within a month and a half. So are there regulations and they're different within different states that we're seeing right now, or is there something universal across the board?
No, because cannabis is still considered Schedule 1 or highly controlled under federal law. And so all of the legal framework around cannabis is controlled by the states that have legalized, and their laws are in conflict with federal law, but the federal government has decided to hold back on enforcing. So it's allowing these state-regulated markets to emerge. So basically all the rules that are currently in effect are state, or almost all of them are state rules, and they do vary widely from state to state. New York State just went legal. The stores are just starting to function there now. So that's probably why you were seeing all of those signs. I'm from New York originally. I was back there a couple of months ago, the week that legal sale was starting, and or that the decriminalization went into effect, rather. I couldn't believe it. There were so many people smoking weed on the city streets. Washington Square Park was full of people selling weed and people smoking weed. It was a very visible change. But so New York State is just putting its regulations into effect. In fact, some of them are open for comment now. What warnings will be used, how will it be packaged, and so forth. New York's doing some good things, like the tax on higher potency products. They're proposing some better warning language and some other measures that are good. So they're doing better than California on a number of things, but they don't have hard limits on turbocharging, for example, or high-potency products.
Right.
So if you're a New Yorker, roll up your sleeves and get active.
Well, I will say this.
It's what we do in our communities that'll decide it. I'm sorry, sir.
No. Thank you for that great answers. But I will say this is that it's noticeable, the uptick. I'm just making this statement because I'm agreeing with you in regards to the areas, and it's not just areas like Washington Square Park, which are predominantly NYU, which is a college campus where many, children from all over the world come and they just do whatever, mainly wealthy. It's in areas like 42nd Street, Grand Central, popular areas that tourists come everywhere, financial district, downtown by Wall Street, where it's very noticeable that there's an uptick in usage. And I'll just say this, as a parent, it's been something that I monitor with both my sons, especially my teenage son. And it's very interesting to hear the dynamics and as far as the law is concerned. So going forward, I guess I'm just going to have to keep paying attention as things just started getting underway here in New York. Thank you for your time. I appreciate you. Thank you, Gus, for the platform again.
Yeah, it's really good that you're talking to your sons. I would say parents, talk to your kids. you don't need to make it out like the demon rum, but you do need to be really clear that using it, especially using it young, has problems, that they're better off waiting as long as possible. And if they do use, they should use very small doses, start with half an edible or, and stay away from the concentrates and the vapes and these much more potent products, which their friends may be handing them. It's actually very scary, the data that teens will tell you on the number of kids that are going to school high, that are getting high at school because vaping is so invisible and you can do it without smelling like pot. And teachers are seeing this. Principals are confiscating, vape cartridges and all these devices. The sale of the legal hemp products with THC is making it all worse right now. So you really do need to talk to your kids and communicate with them.
Thank you.
Great tips for parents. I love it with such specifics, like just do a small bit of the edibles, stay away from the supercharged concentrates and the shatter and all that. I always think about the names that they give certain products, like, why do they call it shatter? You don't think they call it that because it'll
Does it look like broken glass?
Well, I was thinking that too. I was also thinking it could be because
your brain's going to look like that after it's done.
That's what I was thinking. That's what I was thinking. Like all these crazy names. Like I think I'm going to pass on all of that. Like, whew. Let's see. The person caller at 2262. Did you have a question for Dr. Lynn Silver?
At the moment, yes, I'm currently still at work, but if I have some time later, I definitely will have a question. But thank you.
Oh, for sure. We'll swing back if you have a moment in the workplace. Let's see, the caller in New Jersey. Oh, everybody in the tri-state area. Caller in New Jersey, did you have a question, or were you just listening? He was with us first time around. Did you have a question, sir?
Oh, yes. Hey, how you doing, to the guest? So where did this, if you want to call it a trope or this information that marijuana helps with anxiety? Because I do have a friend that is a daily marijuana user, and she says that it helps with her anxiety. So where did that come from? Why do people believe that?
Why do people believe it? It may be that some people are helped by it, but clearly it's pretty clear that others become more anxious, especially with high doses of THC. So I wouldn't say nobody is helped by it. I don't know your friend's specific case. Marijuana is a really interesting plant. It has receptors throughout the brain and throughout the body and a lot of different physiological effects on people. And we're really just starting to understand, not just starting to understand, but we're still learning a lot about the harms and the benefits. There are a lot of medical uses that are being claimed by products, but very few are proven. The proven ones really are control of certain forms of epilepsy, reducing nausea with chemotherapy, help with certain forms of pain or spasticity for some people. The evidence on anxiety or mental health is not good so far, and hasn't really supported it. But there's more research to come, and it may be for certain people or certain situations that there's benefit. Many people take it for insomnia, but the data on effects on sleep are actually not that good, and tend to demonstrate that it doesn't improve sleep quality. But we're still learning. I wouldn't be surprised if we see more medical uses emerging and positive evidence. But honestly, it's like any other medicine. I expect the FDA to really study stuff before people can sell it to us and tell us that it works for something. I'm really glad we have the FDA requiring all those studies before people can sell us medicines. And I frankly believe in the same standard for cannabis. You know, if the industry wants to say it works for anxiety or it works for anything, you know, for depression or something else, they should have to prove it. You know, like at least one company did that for seizure disorders. They studied CBD. They did all the trials. They found that it worked for a very specific group of severe seizures, and it's on the market now as a licensed drug. And that's good. They went, you know, they did the work, they did the research, and they got the results. But there's probably a lot of other claimed uses that are not true. And, you know, sort of sorting the wheat from the chaff is what's happening now. You know, so your friend may be right, she may be wrong, I don't know. You know, I think a lot of people are using cannabis, trying to self-medicate mental health issues, and in some cases they're doing themselves harm. In some cases it may be helpful, but I think we still need to figure that out.
Okay.
I would certainly say it's not that benign, completely safe stuff. They can't assume that it's
so
safe.
you say, so doctor, so, and you said something about anxious. So anxiety is the feeling of being anxious, and also, is there any evidence that marijuana increases that feeling?
Yeah, especially people who take a high THC product often have anxiety reactions or paranoia, and in some cases an extreme that's just acute psychosis, hearing things that aren't real, you know, seeing things that aren't real. But anxiety and paranoia with cannabis consumption are very common reactions. Especially like a young person who hasn't used a lot and goes straight to, you know, vaping something high potency. It's common. We have a lot of people ending up in the ER with anxiety, paranoia, other types of acute episodes like that from cannabis.
Okay, one more question. How about mood swings and depression? Is that some magnified like results of chronic marijuana use?
Does depression make chronic marijuana use worse? Is that what your question is? Or vice versa?
Yes. Does marijuana make it worse, or even mood swings and intensifying depression?
The data on depression has been mixed. So there have been some studies that suggested it was likely to cause or exacerbate depression, and then there were other studies that said it didn't. So that was one of the areas where I don't think there's really a consensus yet on how it affects depression specifically, which is why we did not include it in the California warnings law. Some people were arguing for it, but the evidence on that is not as clear. Like when the National Academies of Science reviewed evidence on how marijuana's benefits and harms, they felt that it wasn't as clear for depression. Nevertheless, as I mentioned, the giant study that NIH did on suicide found that cannabis use, and especially frequent cannabis use, was more likely to be associated with someone thinking about suicide or trying to commit suicide, even when they controlled for whether those people had serious depressive illness. So a person, you know, with serious depression, even more so, but even those people who didn't have serious depression were more likely to think about or try to commit suicide if they were using cannabis, especially if the more frequently they were using it. So that's not the same thing as making people more depressed, but it's the same thing as as potentially making people more likely to act on whatever their sad feelings were and their lives, or thinking about ending their lives. So that's another big area of concern.
Thank you so much, Doctor.
There's a lot of chicken and egg discussion. Is the person using marijuana because they were depressed, or are they depressed because they're using marijuana? That's like a complicated methods discussion, but the evidence so far suggests that marijuana may not help and may make things worse, particularly suicide risk.
We have a mommy in the Bay Area, California's Bay Area. Incidentally, I was talking about black entrepreneurs being white-walled from participating in the cannabis industry. I think I spoke with our caller here about that. I think she even knows some black entrepreneurs who've had problems with that. Racism, white supremacy in terms of trying to root out, keep out, exclude black entrepreneurs from all the millions and millions of THC dollars. Bay Area mom, did you have a question for Dr. Silver?
Yes, thank you for taking my call. Greetings to you and Dr. Silver. The cannabis economy in California. When they legalized the cannabis in California, they started giving out opportunities for people who went to jail to open a dispensary. A lot of the people that were able to come up with the money, some of the money came from people that had money, that already knew about the program, that knew that some of the people that had gotten out of jail for selling cannabis prior to the legalization would be able to get a storefront. A great deal of the people lost their storefront. Do you think the legalization of cannabis in California and using that program for people who wouldn't be able to get a cannabis license? Let's see. Okay, people that weren't able to get a cannabis license that had money went through the people that got the opportunity to get the license and they lost their business. Do you think it was designed to do that, just to get a free foot into the business, utilizing these people? And I'll mute my line. Thank you.
That's a great question. There's been a lot of discourse about, so the equity questions you asked about cannabis. First is ending mass incarceration and putting people in jail. The second question that's come up around equity is the profit from this industry going to go back to the people who, were arrested for it for decades? And how should that be dealt with? In the state of California specifically, not enough was done. So the state licensing rules until very recently, did absolutely nothing to favor what have been called social equity applicants, people who were victims of the war on drugs, or whose parents were victims of the war on drugs, or whose communities were victims of the war on drugs. Of California's 539 cities and counties, for example, only about, I think it was 22 last time we did the count, had any kind of equity in licensing stipulations. It's a very low percentage of cities and counties. Oakland was actually one of the first that offered a special license. So as I think I mentioned earlier, my preference would be a Quebec-styling license where nobody is trying to have a profit-making venture off cannabis. But perhaps, for example, we could favor all the job opportunities being for equity in hiring. But if you're talking about issuing for-profit licenses in the community, you can make it so the first couple of years, 100% of those licenses have to be equity licenses, or 50%. But that's not what's happening. So these investors with lots of money are coming in. They're sweeping up the best spots. They have the money to invest to fulfill all of the expensive regulatory requirements and build the store. And even when an equity applicant gets a license, sometimes they're failing, or very frequently they're getting bought out early by people with more money who then take over the business. So there's been a lot of that going on. Basically, I think the way our policies are set up, they are absolutely not guaranteeing that any significant part of this emerging industry's profits are going to those who were the greatest victims of the war on drugs. That's not happening. We have examples. We have great, entrepreneurs of color, some success stories, some jurisdictions that have tried to create better policies. But overall, if you look at the full picture across the state, it's very limited. And I know California best. It's a very limited percentage. New York State, I think, is making an effort to have the first round of licenses have a significant part going to equity applicants, but and several other states are trying harder than California did. But it's going to take a lot of work and a lot of thought, and really making it a priority if you want it to be real and not just some symbolic measure for them to be successful. On the other hand, if I'm going to put public money towards subsidizing a business, I'd rather put it to a daycare center or a healthy food store or something else. I wouldn't put it towards a liquor store, and I might not put it towards a cannabis store. But I would provide high priority in licensing to those applicants and really try and do everything possible to make them successful. And that's not happening enough.
Woo! Making too much sense. About to do applause. We can't even get a grocery store in Buffalo like they got recreational cannabis in New York State. Like, I was going to say, now how long does it take them to get a dispensary in the east side of Buffalo? We can't have a grocery.
Yeah, really. I mean, like in Buffalo, let's first pay for that grocery store where they had the shootings, and 10 of them, before you pay for the liquor store or the cannabis store.
Absolutely.
There's probably enough of those.
Lactation center, I would vote for that too. Any sort of farmer's market, any of that, all of the above. Let's do that. Then we'll get to the cannabis store like later. But I totally support the equity applicants. Did she answer your question, Bay Area Mom, about the folks using that to kind of finagle and get in and then booting out the person who originally was on the equity application? Did she get your question, Bay Area Mom?
Yeah, that was pretty good. I can put together the rest. And thank you so much.
For sure.
Thank you for the question.
Let's see. Retired firefighter, I think we got. Unless we got everybody. Any other parents, make sure you don't wait till the last moment. Star 6-1 if we have other parents. Retired firefighter, do you have a question, or are you just listening? He was with us first time around.
Yes, I have a question for the doctor. Could she give us some healthy alternatives for those young people, especially who say that they use marijuana for their mental health issues? And could you give us some healthy alternatives opposite of using marijuana? And please not let it Ritalin be one of the things on the list. And that's my question. Ritalin.
Oh, Ritalin, no. I mean, I think it's about fewer drugs of any kind. People have real stresses. Youth have many mental health issues. I think the first thing is just making sure that our youth have access to other healthy activities, to nature, to outdoor activities, to camps, to youth programs, that they have access to social opportunities, to meet and to work in healthy and safe environments, that they have opportunities to contribute to their community in ways that engage them and develop their minds and keep them from getting depressed and, sitting on a computer playing video games all day long. I think the ways of engaging our youth in the community and with each other that don't depend on alcohol and drugs, whether legal pharmaceuticals or illegal ones, are the most single important thing. That we have educational systems that are working are the first option. I don't like seeing increasing rates of prescription drugs for our kids. I don't like, I'm not one to say alcohol is safer than cannabis or cannabis is safer than alcohol. Neither of them are good for young people. There is a need for teen mental health support. We do have a lot of teens with mental health needs and substance abuse needs. So making sure that our healthcare, that kids have access to insurance and that our healthcare system provides those services that they need, hopefully without medication, but even with medication when they need it, is also very important. But I think a lot of teen depression and mental health problems comes from isolation, comes from lack of access to nature, from lack of healthy opportunities for other forms of engagement, and that we need to try and create those supports for them and have our whole community be supportive for our young people. And that's, that for me are the best protections from cannabis.
Okay, that opens.
I mean, there are some kids who need Ritalin, but it shouldn't be that many, and I don't think we can Ritalin our way out of child mental health issues.
Right. Thank you.
Much obliged, retired firefighter in Florida. Let's see. Make sure I got all of the folks. We normally ask folks at the beginning. I switched it around just because this was kind of different content from what we would normally be talking about. Plus, we just had our first program conclude right as this one began, so I was kind of getting my bearings together. For folks who've not seen you, Dr. Silver, you are a white woman, is that correct?
I am.
Right on. We normally ask all of our guests at the very beginning, and it's so interesting because it's come up so many times in the program already. Most interestingly, Dr. Silver, she said way back when she started out, she was going through med school and everything, she said they were talking about the disparities between black birth rates and white birth rates. And she said those disparities, I think she said it's been 40 years. She said those disparities are still here. Is my memory bad? Did you say, was it?
Yeah, that was the disparities in low birth weight, in babies who were being born too small or too early.
There we go. Low birth.
That's still there.
Still made no progress. I've concluded the reason.
It has made some progress, but it's still inequitable. It's still unfair.
Here we go in that word again. I've concluded the reason that is the system of white supremacy, racism. I take those two terms, racism and the term white supremacy. I use the same definition for both terms. The definition I use is as follows: a global system of people who classify themselves as white and are dedicated to abusing and or subjugating everyone in the known universe whom they classify as not white. Do you think such a system exists? Do you think that definition is accurate?
Wow. I think institutional systemic racism totally exists. I think there's a lot of societal structures that people don't even realize contribute to it and yet sustain it. So I don't know if it's always a group of people doing it as, consciously, as you just described, but that there is a whole set of societal structures and characteristics that keep people of color down is absolutely real. You asked me what I do at PHI, and the other job I have is we've been working really hard to create something called the California Health Equity and Racial Justice Fund and get the state to work on making sustained investments with community-based organizations to fight institutional racism and build health equity. The legislature supported it the last 2 years, and the governor blocked it both years, so we didn't get it again this year. But the whole idea was to try and build strength in communities to take down these structures that manifest and create barriers of institutional racism. So I think I'm pretty close to your definition. I don't know if I'd go exactly the same words, but it's definitely there.
So many things I could say. I have to go back to the definition. Normally the program would start here because definition's so critically important, especially the definition for racism. I just want to make sure, did Governor Gavin Newsom block this effort?
Unfortunately, yeah, he did a lot of other good investments this year in social programs and other needs. But yeah, the last 2 years, the administration did not support this health equity and racial justice fund that, I don't know, over 200 different organizations across the state we've been working on promoting. So hopefully next year, but it's definitely an area where we need to invest as a society and make some serious change so that pediatricians training this year won't be saying 40 years later, oh, black women are still having smaller babies. Like I said.
Wow, okay, good to know that. Back to the definition. For this, definitions are critically important. Institutional racism is not the definition that I gave, and this is when I say it's so important because so many times people use the term racism and they assume that we're all using the same definition, and I found that's not the case at all. So I tell folks, like, if they...
Can you restate what you said?
Yes, ma'am. So my definition, a global system of people who classify themselves as white and are dedicated to abusing and or subjugating everyone in the known universe whom they classify as not white. Do you think that definition is accurate? Does such a system exist?
And you're calling that the definition of institutional racism or of what?
I didn't use the term institutional at all. I said that's my definition for racism. That is also my definition for white supremacy.
Yeah, for me that sounds like white supremacy, like those people who consciously dedicate themselves to perpetrating that. But I think that they're above and beyond those who are consciously dedicated to subjugating people of other colors, that there is a whole broader range of people who aren't consciously white supremacists, but who end up being complicit in policies and practices that have the same effect. That would be my only concern with the definition, that there is, clear white supremacists who know what they're doing and they're trying to do it, and then there's just a whole second layer. Does that make sense?
There's some metaphors there. The lot and the laughter. Now that's wow, lots of laughter. There would be lots that I would be suspicious about. That just wow, even within the context of
laughter,
our conversation.
That's my nervous laugh that my children tease me about all the time.
Oh, okay. Even if it was just nerves. Again. Yes, even the nerves. That would be. The logic is very strained, even within the context of this conversation for that. Or I guess let me ask this question. I see we had a parent. Let me get your question because they might have important questions that they need information for their children. But Dr. Silver, who do you think is more informed about racism, white supremacy, meaning what it is, how it works, the daily operations and what have you, how, black people are not going to be able to get these licenses or what have you, or even if they do have some of these equitable set-asides, They might even be duped out of those as well. Who do you think is more informed about what racism, white supremacy is, and how it works? Do you think white people are more informed about that, or do you think non-white people are more informed?
Oh, no, I think the people who are being victimized by it, are definitely the most informed. I mean, in part, that's why that fund that we were trying to use, create was specifically about putting resources in the hands of organizations of communities of color to act on racism and to, respond to what they perceive to be the issues in their community. So, yeah, I mean, unquestionably, I think it's people are being affected by it.
Huh, okay. But you are a white woman. You've not been affected by white supremacy racism, but you are informed about it, correct?
I've not been directly affected by it, but I'm affected by living in a society that's affected by it. I think my children grow up in a society and witness injustice and inequities and, all of the societal issues that entails throughout their lives, and all of us do. So I think, although I've not personally been affected by racism as a victim of racism, I think we all live seeing its consequences in our communities.
Right, but within the context of what you just said in terms of being impacted, that non-white people are more informed about racism because they're impacted by it, in that context, you didn't mean that broad general sense of impacted. You meant impacted as in targeted, unless I misunderstood you. So in that sense, you have not been impacted, meaning one of the direct intended targets of racism, white supremacy, but yet you are still informed about that system. Isn't that true, Dr. Silver?
I mean, I try to be informed about it. I try and fight it and, other forms of social injustice. That's what I've spent my life doing. But, I'm a white person by birth, so that's just a fact. But I try and, make my work contribute to eliminating different kinds of injustice, including race, of which racism is one of the top ones.
Right. This is also one that's important, interesting, just because you went through med school and everything. I bragged about it, said we have a medical doctor coming on the program. You said going through med school that you all talked about disparities in birth weight, right? You are informed. This is a topic that you've been talking about for decades, and even the cannabis legalization. So I'm just saying it is a true statement. You are, Dr. Silver, a white woman. You have not been impacted by white supremacy racism as a target of that system, but yet you are still informed. Is that a true statement? Yes, no?
Yeah, absolutely. And I mean, I think most people who work in public health, like I do, a lot of our work is around equity and inequity and how disease and illness are affected by racism and by social injustice. So, I think in particular, folks in the health professions who are working in public health study this, care deeply about it, are working to change it, no matter, what color they are.
Right on. I see you, Kwaku. I'm not forgetting you. Our caller, maybe even a parent on Skype, right there. She said she was from the New York area. My attention perked up. Dr. Silver did, and particularly being someone she's not a teenager, we'll say it that way. Dr. Silver, is the name Joseph G. Christopher, is that familiar to you?
Joseph G. Christopher. Not right this second, but I have a terrible memory for names.
Okay.
If you remind me, I might perk up.
Let's see. For New York City, how about Midtown Slasher?
Oh, Midtown Slasher. I don't remember that particular case, but gosh, there's been all kinds of crime problems in the city, so I don't remember that one.
Okay. This is 1980. going right into 1981, Joseph G. Christopher, Midtown slasher and the .22 caliber killer. He is a white man who he started in Buffalo. He killed, lots of black males. He was exclusively targeting black males. He shot and killed a number of them in Buffalo, starting at a Tops grocery store in Buffalo, importantly. And then he went to New York City, and he killed at least 4 black males, many of them on the subway in Midtown Manhattan. I believe it's the 24th. It was right before Christmas in December of 1980, but he was not apprehended until April of 1981. But Joseph G. Christopher, he killed, and then he killed more people even after all that. And it ended up, I think he killed about 16, 17 black males in total, stabbed. And he killed 2 black males in Buffalo and carved their hearts out. In addition to killing them.
Oh my God.
Just really savage. It's been amazing, the people that were you in New York in the 1980s, or had you departed by then?
That year I was working in Nicaragua in a rural area with no internet, no phones, and no email. So that's probably why I never heard of them.
Wow.
I was very far away from the news that year.
Amazing. Nicaragua. That's amazing. You're with everybody else because we have lots of folks who were right here in New York when all of this happened, and they have no idea. So, hey, at least you got to be doing something interesting. Let's see. Our call. I went to grab them, and I don't know if they got knocked off. Let's see. I'll look and see if they got. There they are. Our caller. Did you have a question for Dr. Silver? You should be with us. You're on the Skype line.
Greetings.
Your volume, see, it did it again. I was prepared this time. Your volume is still not cooperating. So if you can make the adjustment, what have you, speak up, get closer, all of that, and then try again, sir.
Is that better?
Much better. Thank you.
Greetings. So my first question, I wanted to know what exactly can somebody who has consumed marijuana in the past, what should they expect to happen to them?
I mean, if you use marijuana occasionally in the past and you're fine, nothing. If you use marijuana every day heavily for years, you may have, especially when you were young, you may have some neurologic changes, or you may not. You may be fine. I don't think you'll ever know if you're any different than you would have been. When we do these big studies of people, like studies, for example, a study that was done in New Zealand that looked at thousands of 17-year-olds and followed them until they turned 30. The kids who were using cannabis daily when they were 17 were, less than half as likely to graduate high school or college. They didn't have more depression. They didn't have some other issues, but academic performance, for example, went way down. So, that may have affected your life, or it may not have. I don't know your story. And people's story is different. There are other kids who did fine and went on to college and did great despite using, but the risk of not having a good outcome went way out academically. So, it may or may not have affected you. I wouldn't, it's not like smoking. It's different than smoking tobacco, where your risk of lung cancer many years later may affect you, even though risk goes down once you stop smoking tobacco. But if you were using heavily and have stopped, and you're doing okay, you're probably doing okay.
I see. Thank you. My next question is how, in your experience and what you've observed, are people classified as white largely the people who own, control, distribute marijuana?
Are people classified as, I'm sorry, could you repeat the question? Are people classified how?
People classified as white, are they largely the group that owns, controls, distributes marijuana as an industry?
I haven't seen a good racial analysis of ownership. As the industry has evolved, my impression is that probably yes, that the vast majority of businesses that are being launched are probably controlled by whites or wealthy investors. Some of them are Asian, some are from other racial or ethnic groups, and some are from the Black community. But my impression is that probably most are white, and that we're seeing big companies aren't as bought in the United States yet because it's still federally illegal. Companies like Altria and Coca-Cola are starting to buy in Canada, where it's legal across the country. But I'm guessing that we'll also see this increasing role of large corporate actors as when and if the federal legalization situation changes in the U.S. But the presence of owners of color in the cannabis industry is still modest.
I see. My last question is, thank you very much. How should non-white people, do you have a suggestion for how non-white people should, I guess, become more informed or become more informed about marijuana? Because I suspect that we are being affected indirectly. I know there a lot of the discussion and a lot of the things directly have been identified, but do you have a suggestion for what non-white people can do?
Well, I think one thing that's important is figuring out where the tax money goes. So like we did an analysis of where the tax money for local government was going in California, and it looked like most of it was going to law enforcement agencies, which is not where we wanted it to go. We want that money to go back to communities and to youth and to educating communities, particularly communities of color, about substance abuse, but also, potentially other programs that help youth just develop well and fully, and not need to rely on substances. So trying to capture any cannabis tax revenue that's coming in both at the state level and at the local level where you live, and making sure that those funds can be used to educate, to regulate better, to engage communities of color in changing the rules of the game for their community. Like in tobacco control, there's been wonderful activism from Black community, Latino community, in educating their community and developing kind of culturally and linguistically appropriate education, but also in engaging in policy in their community and deciding where a store can locate and, what the rules of the game will be. So I think using tax revenue in particular to fund community organizations of color to work on these issues, to carry out education campaigns that are appropriate for communities of color, are all positive steps that you can take. There's some really good examples from tobacco control that I think could be applied here. Like California funds, networks of community organizations and communities of color to work on tobacco control with their communities and to educate. And that's been really positive.
Thank you.
I was confused. I didn't know if he got his last question in. Our caller, he asked us to circle back. I guess he was in a noisy environment. 2262, is it quiet for you to get your question in, or were you still just listening, sir?
Hello.
Yes, sir. We can hear you.
Yes. I wanted to ask you just because I'm wondering, or was one of those equity candidates looking to open up an extensive but so to get to a better environment. Thank you. Yes, I was one of those candidates who was looking to, who was a part of a group who was petitioning to get cannabis licenses. And from my experience, from what the contract said, we will only own 30% of the business, while the rest of the cannabis business will be owned by the fellow investors who help pay for all of the building and the locations and the flower for this product. I wanted to ask, is that a common contract? And you said earlier about eventually those investors would buy out the person they used who was affected by the war on drugs.
I had some trouble hearing you. I heard a question that in some cases the equity licensee may only hold 30% of the business and then get bought out. Is that what you were asking? Or could you, or Gus, can you summarize?
Yes, that was my question, because that was one of those candidates, and my contract specifically said only 30%.
Oh, okay. He said his contract. He was one of those candidates, and he said his contract specifically said that he would only own 30% of the business. And is this standard operating procedure to use this candidate to get the business and then to buy that person out and move them out so they're not even a part of the profit anymore?
I think that is definitely happening. So some jurisdictions defined an equity applicant requiring that they be a majority owner, which I think is much wiser. I think that otherwise you can't keep yourself from being forced out. Some other jurisdictions established that you can't transfer ownership if you're an equity applicant. That had some pros and cons. On the one hand, it made it less likely for the owner to be forced out, but on the other hand, it made it harder for them to be able to sell their business and make a profit on the sale. So it varies, because in California, that's something that's been regulated by the city or the county, and there's 539 of them. And as I mentioned, I think it's only 20-some that have any provisions for supporting social equity applicants. It's different from town to town. I believe some of them required at least a 50% interest, though. Equity applicants might need to unite and try and change those. I mean, I think we need much more stringent priority for equity applicants. I mean, if only if in the first year or two only equity applicants were eligible, or 50% of the licenses had to go to them, then they'd be in a much stronger bargaining position too with sources of capital. Right now it's a pretty weak bargaining position in most places. So it's not a system that's been designed to effectively support equity applicants, in my opinion.
Thank you for your response, and that'll be all my questions for tonight. Thank you, guys.
Much obliged, good sir. Probably standard operating. We've heard that in a number of different applications too, where they'll, in like construction companies and other entrepreneurial activities, where they will have something where it'll be I don't want to say set aside. It'll be some sort of program, counter-racist aim. Hey, we're encouraging black entrepreneurs or non-white entrepreneurs. And so they get these people in, and then somehow, some way, they will be bamboozled, and now they're no longer they're no longer earning anything from the property, and it'll be individuals classified as white who have taken over the whole enterprise. It's amazing how that's why I say that sort of thing is not happenstance or coincidence. System of white supremacy, racism. Did I hear it correctly, Dr. Silver, when I think it was the previous caller, and you were talking about some of the same activism that black people and other non-white people have exerted around tobacco could be exerted around cannabis. And you said in terms of regulating activities of tobacco companies and, where they can have stores and that sort of thing in areas where black people reside. Is that accurate?
That's correct, yeah. Yeah, we've been working with a number of community organizations of color around these issues across the state.
Where are some of the areas, I guess in California specifically, where black people have been success? This must be recent success, where black people have been constructive in keeping or controlling, exerting control over what tobacco companies are doing in areas where black people reside.
I mean, like the African American Tobacco Control Leadership Council, for example, has worked nationally to try and end menthol in tobacco, which has been, marketed directly in black communities. That may be happening. It still hasn't happened, but a number of communities across the country, quite a large number of states and local government have taken action to end tobacco products that have been marketed specifically in the black community. They've worked to end concentration of tobacco retailers in black communities. I think a lot of the mobilization we've seen early in the black community around cannabis has been more about equity and licensing. So there were a number of organizations of color, and still are, trying to fight for equity and licensing, and then having a part in the economic pie of the cannabis industry. And only more recently are more organizations also getting involved in the health, public health and health protection concerns as well. Some of them work on both sets of issues. We've worked on both equity and licensing and equity in protecting health. And a number of our partner organizations, Pueblo y Salud in LA and others, are concerned about all these sides of the equity issues. But there's a lot of black activism has gone into the issues of equity and licensing, but still with modest impact on what the state's been doing.
For sure. I was taken aback with regards to tobacco, because that's a subject that we covered before we got interested in the whole cannabis legalization, and then continued to cover in the interim after cannabis was legalized here in Washington State and then beyond. We had Dr. Valerie B. Yerger as a guest on the program. She's see, familiar with her work. White people are not ignorant about racism. She was a guest on our program, and then we also had Vernelia Randall. She was a guest with us way back 2009. We talked about her book, Dying While Black, which has a whole chapter just on cigarettes and what have you, and the dangers of tobacco and nicotine. And so much of the information that they shared was about the lack of control that black people have with regards to nicotine and tobacco products. And that's why, exactly what Dr. Silver said earlier about, hey, the danger, the fear with these cannabis advertisements and what have you is that they're not going to be in more affluent areas where individuals classified as white reside. They will be in lower income areas because they have less restrictions about these advertisements. So it'll be more black people who are going to be, saturated with all this. Oh yeah, go and get the, THC Fruity Pebbles and all the rest. I think that was part of the watering down too. They took the warnings off of the billboards. My memory might be bad there, but I think that might have been part of the,
No, you got it. You got
it. Take that one too.
That's exactly what they did.
Take that one too. But I mean, that's exactly what I mean. Like black people, there's no evidence, at least none that I've seen, none that Dr. Yerger shared with us about black people exerting control. It's been exactly what I said earlier. White people and the system of white supremacy. It'll be tobacco ads, maybe it'll be THC ads, or both, or whatever it is, but it'll be where you all live. And she already told us before, a greater prevalence of those ads, greater likelihood that you are going to consume those products. That's why I thought all of just
So Valerie, did you know Valerie's partner in crime, Dr. Phil Gardner?
Oh no, I don't know Dr. Gardner. Who's Dr. Gardner? Who's he?
They worked together with the African American Tobacco Control Leadership Group, and he was an early contributor to our project. But Phil, who was on California's tobacco control oversight group was one of the first people in the state to say, no, we have to look at tobacco and cannabis together. We have to write our policy taking both of them into account. And, you know, all of these games the tobacco industry played, they're going to play the same games, you know, with cannabis and in communities of color. So he's been just a wonderful voice helping to raise awareness and you know, sound the alarm and also identify the need for action in communities of color on these issues and on what they call the triangle or the interface of tobacco and cannabis.
Wow.
Very similar. I'm afraid Valerie's going to have to write a new chapter for that book of hers, Dr. Valerie.
Absolutely. We asked her. This was in the I think she was with us. It was because they just got the ban. That even with menthol cigarettes, they just got them banned. Vernelia Randall was with us 13 plus years ago talking about, man, black people are so, she didn't say lame, but I mean, that's what you call it. That's the definition. You've been working for all these years talking about the problem with menthols and they're so addictive and man, and they're concentrated with black people. Get all these black people smoking menthol cigarettes and they're so damaging. It took until, I think, months ago. I think that happened this year. I think that was literally 2022. They finally.
I don't think it's final yet. They're still working on it.
See, it's not even in the finals, but at least rolling towards, hey, it looks like it could happen in 2022. But yeah, I remember we asked Dr. Yerger about cannabis. At that time, what are your thoughts? Do you have any concerns? And she said, I haven't even checked out that. I'll have to do more look. I focus so much time and, energy on tobacco, and she had so much great information. But she said, yeah, I'm not an expert on that. Don't claim to be. We'll have to do more digging. But wow, not that I'm.
Yeah, April 28th, the FDA finally proposed the ban on menthol cigarettes, but it's open for public comment. It may take a while yet before the ban actually happens.
I'm not
rules
surprised.
Been proposed, but they better work fast.
Indeed. Did we nab all of the parents' questions for Dr. Silver? Make sure we didn't miss anyone who had a question for Dr. Silver. Parents, folks, question they want to make sure they get in. Everybody satisfied they got in their questions for the evening?
Yes, may I ask something?
Our Bay Area mom. Yes, ma'am.
So, in California, Oakland, California, the middle school and elementary school children are smoking marijuana now. Their clothes are smelling like it. They're very aggressive. They're using the vape pens. And they're not getting into any trouble. They're not really, there's no disciplinary action for their cannabis use at school. I'm not saying if they're reported, they may not get their parents called. I'm just saying that they're just doing it as if they're in the park. Do you think that marijuana, since it's been legal in California, has been marketed towards black children? And I'll mute my line. Thank you.
It's a huge problem. You're seeing a lot of kids of all ages using in school, go to school, getting high at school. It is interfering with their education. The principals know about it. They're confiscating devices. I think we have a real challenge because on the one hand, you don't want to expel or suspend a lot of kids, particularly kids of color, for use and just make educational outcomes worse. On the other hand, you can't just let it ride. So there's all kinds of, efforts in the school system around restorative justice and other things to have approaches to dealing with disciplinary interaction that doesn't lead to expelling or interrupting the education of kids who are using drugs. I'm not an expert on that, but I know that these are different approaches that schools are trying to take, but there's no question that this is, at least in part, thanks to aggressive marketing of cannabis in California and in other places where it's being legalized. It is being intensively marketed. Some of that marketing is directed at youth. We actually have a research project going now looking at marketing and what marketing is attractive to kids, what marketing is being directed at kids. We definitely see marketing directed at youth. Haven't seen a ton clearly directed at youth of color, but some examples of it. But it also that also depends on where the advertisement is being carried and who's being exposed to that. And we don't have that analysis. You know, where is the billboard going? And who are the, you know, what are the children who are going to see that billboard look like? We definitely have research showing that kids who are exposed to billboards, for example, are more likely to use and more likely to develop dependency. So, yeah, I mean, the product's being promoted. It's being promoted in ways that definitely expose youth. California's laws in particular are lax, like New York's looking at advertising regulations that would be much more restrictive on where and how you could advertise. And we're going to get the result that you would expect if our kids are exposed to marketing and promotion. And it's going to be a problem for them. It's going to be a problem for their education.
Children are the future. Bay Area Mom, by the way, is an educator. So she's in the classroom on a regular basis and seeing what's happening to the children and what have you. She said middle school.
So what should we do? I'd ask her.
Let's see.
What should we do?
What do you think, Bay Area Mom? What should we do? What do you think?
You're a middle school teacher.
Funny. Well, I noticed in Oakland there's a great deal of dispensaries in Oakland. A great deal. I think we should replace the current system with a system of justice, and maybe they won't have to crutch onto these things to cope in Oakland. Yeah. In the meantime, have some kind of no drug tolerance. I know if I'm selling drugs within a 500-mile distance of a school, or so many feet, from a school, I'll go to jail. But if the children are under the influence at school, nobody's really doing anything. And it could be some of the teachers are under the influence at school just to cope with the students. So replace the current system.
Yeah, I mean, it's a complex problem. You know, some places are letting dispensaries open a block or two away from school. The state law only says 600 feet. We've encouraged jurisdictions to use a minimum of 1,000 feet from a school, but only a minority across the state use that large buffer. But that, you know, even keeping dispensaries away from schools and stores away from schools is part of it. But it's, you know, I think having our kids have social resources and coping skills and all those other supports, that not have them turn to this stuff is also important, and limiting marketing. Thank you.
For sure. The caller at 1159, we did hear you. I noted that here. I'm in Seattle, Washington. I noted that here some of the first, not all, but certainly some of the earlier dispensaries that I saw, I noted wow, I have walked from a school, middle school. I've walked from a middle school to a dispensary without much effort.
Yeah. And you'll see vape shops and smoke shops are often located right across the street from the high schools. The San Fernando Valley Partnership in LA did a whole study of that and found huge percentage of high schools with vape shops right across the street because the city never stopped it. And, if we don't watch it, we'll have cannabis places right next door. Here in Berkeley, the avenue that's right by the university where we've got, tens of thousands of young people, has several cannabis dispensaries located one right after the other. Those folks, their brains aren't 26 yet.
Hey, that's right. Caller at 1159. Did you have a question for Dr. Silver, 1159?
Yes, greetings, Gus, and greetings, Dr. Silver. Doctor, are there any constructive benefits from smoking the sort of THC that is being administered these days and being sold? If any, can you share what constructive benefits could come from smoking this sort of marijuana, if any?
I don't think there are any constructive benefits from smoking high-potency concentrates, for example, or using the high-potency flower. I don't treat patients with medical marijuana, so I don't have personal experience in providing treatment, but we have interviewed several medical marijuana physicians who are actually a few of the ones who are serious practitioners, not just people who sign cards. And they generally tell us that they use very low doses, that what they find to be effective when they are doing medical marijuana treatment is quite low doses of modest doses of both CBD and THC when they're treating people, and that these very high potency products are not the products that they need. So again, and that often if you give too high a dose, you habituate somebody and lose the medical benefits for those patients. But again, that's not my personal area of expertise. But these high potency products, 30% flower and vape cartridges and dabs and waxes and shatters, there's no health benefit to those. And we're really just figuring out what the real health benefits are and what the right dose for those products are. In fact, we recommend that retailers in our model laws for California, for example, that retailers be required to stock lower dose products. Many of them only stock these high potency products now, and we think they should be required to offer consumers lower dose products as well, so that they at least can choose. Just another comment I wanted to make, if you're in California and you want to see what's going on in your local community, you can go to our website, which is www.gettingitrightfromthestart.org, www.gettingitrightfromthestart.org, and we have a section there that has scorecards for every local jurisdiction in California that allows legal cannabis sales, and it tells you what your jurisdiction is doing or not doing on some of these key issues, whether it's equity and licensing or getting rid of flavors or controlling potency and things like that, what they're doing with their taxes. So you can find out the score of your jurisdiction and take action on it if you live in California on our website, and a couple of other states. I think Michigan is studying and doing something similar.
Thank you, Dr. Silver, and thank you, Gus, for having the program.
Much obliged, good sir. Now I think we nabbed all of our folks who dialed in, got all of our questions asked and what have you. It's going to share the address. Let's see, did I get, yep, gettingitrightfromthestart.org. You can go to the website, get more information, especially we have lots of listeners who are in the California area. Go get more resources, even about the jurisdictions, about where these dispensaries are. That itself is fascinating. Is that information at the website as well?
Yeah, go to the section on our work and California local scorecards, and you can see the scorecard for where you live if they allow retail sale.
Getting it right from the start.org, sharing it on Twitter as we speak. It has been a hoot.
Thank you.
Oh, for sure. Least we can do. It has been grand. Well, I guess before you get out of here, I will ask, are you familiar with Dr. Frances Cress Welsing? Have you heard that name before?
No, I didn't know her.
Okay.
I appreciate learning about her.
Okay. She's a medical doctor. She passed on in 2016, right at the beginning of the year. But she was with us. The whole reason your work stood out to me immediately. She was with us, medical doctor and a general and child psychiatrist. Her life's work, I think I could say accurately without overstepping, was to replace white supremacy with justice. And in 2013, she said, hey, I'm a little bit cautious about all this legalizing cannabis, even though they're saying it's going to work against racism. She said, hey, I'm working with patients. They're presenting as psychotic. Like I see, she said it's in medical literature right now that I'm seeing people talk about this. She was saying this in 2013. Does that surprise you at all?
She sounds like a lady with a lot of foresight. The reports of psychosis go back more than 100 years. There were reports from the Indian Hemp Commission over 100 years ago on that. And there's been evidence emerging for many decades. So she knew what she was talking about. In addition to, obviously, she sounds like she was seeing it in person with individuals. So yeah, again, nobody should go to jail for this stuff, but nobody should go to the hospital either. And we've got to figure out a way to balance those concerns.
Great way to start it. Ended. Nobody should go to jail for cannabis. Nobody should go to the hospital either. We have been chatting it up. Dr. Lynn Silver, getting it right from the start.org. Thank you kindly for chatting with us. Always great to give tips for parents. Enjoy the rest of your Wednesday evening in sunny California.
Oh, Gus, can I make one pitch too?
Oh, yes, ma'am.
Go on our website and click on Take Action on the page about the Cannabis Right to Know Act and tell your assembly member to vote for it. Because that's one that's going to put out some information on these health effects. Will only pass with your support. So go on our website, gettingrights.org, take action and send a note to your assembly member to vote for more information for people. Thank you. Sorry.
Getting it right from the start.org. Visit the website, get the warning labels on those THC products. Dr. Lynn Silver, much obliged. We will post the info on the website promptly. Enjoy the rest of your evening and great luck with the campaign to inform folks.
Thank you. Take care, everybody.
Evening. Dr. Lynn Silver. Information on cannabis, things to know, especially for parents. Thought that was so great. Specifics. She didn't jump up and down and say, oh my God, you're going to use cannabis. I'm going to kill you and chomp your head off. And you're going to be grounded for the next one. It's not the worst thing ever. Small dose if you want to try it. Stay away from that crazy stuff. The dab. Same thing. I wonder why they call it a dab. Anything more than a dab might kill you or crack your brain computer or something. Maybe that's why they call it a dab. And then shatter, I think we already talked about that. Stay away from all of that stuff. If you're going to do an edible or something, don't eat the whole thing. Just take a small piece. Try a little bit. See how you feel. Don't go overboard. Can be dangerous, risky. Your brain is still developing. Can't be said enough. Your brain is still developing well into your 20s, late 20s. Protect the brain computer. I cannot believe we were not saying sobriety would be best back in 2013, but we are all still learning. We'll take a quick break, and then we'll be right back here, folks. Thoughts, observations, if their minds or what have you changed again over the last 10 years. Maybe folks didn't get to hear the recap of what folks had to say way back in 2013. But if anything, man, the grandcestor, I doubt it'll happen that way, but wow, Dr. Frances Cress Welsing. So one, she got, hands down, passed away a year before the election, and bam, called the election that everybody got wrong. Called it accurately and arrogantly that this was going to happen. Donald Trump, your next president. That is for sure one. Back up off me, Dr. Welsing. I know what I'm talking about. Flagrantly, she said in 2013, like, ooh, correlation with psychosis. Might want to be careful about all that cannabis, especially all of this high potency cannabis products that they got right now. Like, whoa. At the time she said that, recreational cannabis was only legal in 2 states. Wow. Quick break, and then we'll be right back if y'all have commentary to share. The cows, context of white supremacy. We'll be right back. Hold your thoughts. Let's see.
And from the late 1960s, after the death of Martin Luther King and the riots and the upheavals and all like this, and black people with their fists in the air and all like that, and trying to stumble and fumble and find their way and get focus, the white supremacists made a blueprint and put it into action. And that is, I'm going to have these people so confused, they don't even know what they started out to do. And by the late 1970s, they had just about completed it. And we've been on that ever since. And you mentioned something very important. They are more comfortable than ever. But see, it's like making gorillas comfortable in a cage, or monkeys, or pandas. You still got them in a cage, but they're comfortable. See, so give him some bling bling. It's like giving an animal a brand new car and training the animal to ride up and down the street in it. And then you stand back and point at the animal. Like one white man said in the late 1950s, he said he doesn't care what kind of car a Negro has. He said he's still a nigger. And when he rides by in a shiny car, to him, it's just a monkey in a car. White people built a car, put a monkey in it, trained the monkey to drive the car, so now you're looking at a monkey in a car. See, but black people don't see themselves that way. But this is how the white supremacists see us, and they are the ones who run our business. And we have to know that when they look at us, that's what they see. That's what they see. That's what they see. And at a subliminal level, what they see begins to spill over into our brains so that we, at a subliminal level, see each other that way. And indirectly see ourselves that way.
Yes, context of white supremacy. Wow. 2 programs. All right, posted Dr. Lynn's information. Bang. Getting it right from the start. 2 programs. We'll give folks thoughts on what they have to say. The program, Cannabis, all that, especially parents, stand by. I just wanted to share one tidbit because this did come up on the program today. We had a listener, the question that gets asked, who do you think is more confused about racism? Sometimes we've asked, who do you think is more confused? I think today I asked who's more informed. That's generally the way that I ask, who's more informed. So a listener wrote in, Greetings, Gus. I'm trying to come up with a way to phrase this question to see if we could trap a suspected white supremacist into answering this question truthfully. Perhaps you could phrase it like this: whom do you think is more confused about racism, the racist white supremacists or their black victims? I appreciate your contribution in trying to solve this problem. Much obliged. At least my view, if you ask it that way, that provides so many opportunities for individuals classified as white to be deceptive, dishonest. I think, for one, many individuals, they promote the perception, the belief, the lie that you have racists. I think we heard some of that today. You have racists who are not aware. They're not informed. That's widespread. You hear that from white people, non-white people, that you have many white people. They're delusional about racism, white supremacy. So one way that this would allow is you could say, well, hey, you do have some white people or even some racists where they're just delusional. They just go along and support concepts and are just blind or whatever and don't even see how the things that they do or don't do are racist. They'll have one set there, and then they even have some who say that some of the people who practice racism, that they are just idiots, that they're not informed, that they're not, they didn't go to Harvard or whatever, that they're just down and out, no count white people who are not very smart about anything. So I feel like it allows for a lot of the ignorant racist and just the white person who might not even be a racist per se. They're just ignorant. They're just not aware in general. It would allow for a lot of those types to totally escape. I could be incorrect, but certainly people can think about that. And I think, too, anytime there's a distinction. Oh, that was the other one, too. Anytime if you ask it that way and you say, well, hey, do you think the racists, white supremacists, are more confused, or do you think that their black victims are more confused? If you, and I always say non-white people, I don't say black victims, I always say non-white people. If you do it that way, there are a sizable contingent of folks who believe not all individuals classified as white are racist. So not only do we allow some of the white people, they're just ignorant and they're confused or whatever, even some of the racists are ignorant and confused, there are some white people who aren't racist at all. So now we've got lots of different groups of white people who are no longer in consideration for being informed about racism. That's one of the reasons, or there are several reasons that I would not ask it that way. That's a big one too, though, that, yeah, many people submit that not all white people are racist. Is that true? Even, how would we know that that's true in a system of white supremacy where it seems very difficult to even verify if a person is a racist? Anyway, folks who had thoughts on what they heard from Dr. Lynn Silver, white woman, always fascinating, especially when we have programs where I can even give folks, we've been here for 13 years. Sometimes we will talk to guests where the information I think is constructive, even though it's not directly focused on white supremacy racism. Judith Van Layson is one that comes to mind. There have been many others. This was one. Didn't start asking her if she was white, definition, all of that. More than an hour passed before we got to, oh, yes, white woman, yes, definition of racism, which was interesting. And even the who's more informed, which was interesting. That's some of the structuring, even those programs. And even though I didn't mention racism until about an hour, about 70 minutes into the program, she brought it up. It had come up a number of times before we even got to that point in the program, which is not surprising at all. There are very few topics, if any, you can discuss where racism is not going to be front and center in the conversation. Last thing I'll just say, would have been great if we could have got Ari to participate. Not that it was required, but I mean, hey, if we want to make sure we are not getting distracted about the focus of all of this and impact on young people whose brain computer is still developing. She talked to us, hey, the mental health impact this is having on my child. That is exactly what Dr. Welsing warned about a decade ago. And I mean, to the letter, black male. She was talking about her black male child. 720-716-7300, the code 564-943 pound. Star 61 if you have thoughts, commentary to share. Listener supported, counter racist radio. Hit the blog racism-notes.blogspot.com. 2 programs for the day. Folks with commentary to share, line should be open.
Yes, sir.
Have you heard?
Heard both of you. Let's see. We'll get a 9029 and then we'll get retired firefighter.
Thank you. One of the things I have to admit, I came to my mind later on as she was speaking, especially with brain effects, was I've noticed that most of the peers that I've known that have done or smoked marijuana at early stages in their life and continue to smoke, tell me if anybody else has seen this, but I noticed that they almost stay in that age bracket, almost like if they started it when they were teenagers, they almost, even if they're 30 or 40 years old, they still function like teenagers. And I found it very odd. And I've noticed that across the board with most people who abuse substances, and marijuana being one of them. But it was just something that I thought about while she was speaking about the brain effects, and I wonder if anybody else noticed that as well.
The system of white supremacy is pretty retarding, meaning delaying the development, maturity of non-white people in general, I would say. So I think that happens for a lot of non-white people for a myriad of reasons, although I am certain, or I could see logically, how cannabis could contribute to that process, and just not having people expending all of their energy correctly into developing and doing all of the constructive things that they could be doing. I could see that. Let's see. Retired firefighter.
Yes, sir. When you asked her about the question that we asked the white guests about who's most confused, who is more knowledgeable about racism, white supremacy, a white person or a non-white person, your detail, I thought, was probably the most concise that I've heard to a white person, but she still was able to escape the description. You remember the description that you gave after you asked the question? Hello?
Yes, sir.
Oh, okay.
Yeah. In terms of
you gave
in terms of who's more informed, what it is, how it works, daily operations. Is that the detail you're talking about?
Yes. That was I thought that was very, very, very concise. That would place a white person in a position to where they would have to answer the question. Of course, the laughter that she was exhibiting was a telltale about her being pervasive on the question, and the questions on the subject matter, the laughter. But one thing that is a great sign is when a white person starts saying things like conscious or unconscious. She said something similar to that during her discourse on racism and white supremacy. In other words, some white people are not really aware that they are practicing racism, that sort of thing. And what I think that is a out on white people's behalf, intellectually to avoid articulating on the issue and taking responsibility for establishing racism, maintaining it, expanding it, and refining it. But those are my thoughts on that period in time, which ultimately is the most important part of any program or any conversation with a white person is that particular point. She was making some helpful tips on, through her profession and whatnot, but what's more so important is what she can offer to us as a white person. And that's all I have to say. Thank you.
Much obliged, retired firefighter in Florida. Consistency with that answer, and everybody says the same thing, which also should stand out when all the different white people that we've talked to and all the different locations around the world and different professions and different subject matters, and they all say the same thing, that non-white people are more informed because we experience white supremacy, racism. Then, when you say, well, okay, you're white, you didn't experience racism, but you're informed about it, even with that, you see the resistance. Like, it can't just be, oh, yeah, trying to do the little bit that I can. I'm still learning, but no, it's whoa. We heard, I think, what did we get today? Well, I have been, impacted by it. I mean, I think we've all been impacted by it. Growing up, it's like, whoa. That's not what you said. Like, you did not give some sort of general, everybody is impacted. Like, you used impacted in a very specific context. Which, that's the sort of thing where I point out and be like, see, that's white people deliberately, willfully practicing racism. And again, I'm just left aghast. Why is that so important? To lie and insist that non-white people are the experts on what racism is and how it... She just told us in the same conversation. Man, I've been talking about this race thing since the 1980s. Probably a lot of y'all weren't even born. We're talking about low birth rate of the niggers when I was in med school 40 years ago. That means you're not ignorant about racism, right? Why does that happen with every single white person? Definitely one to ponder. Other folks' commentary, they want to make sure they get in. Everybody satisfied? Got the comments in they need to share? Grant, we'll assume folks are good. We should be talking about some of these same issues even as the book club continues, because there's been so much reefer madness in the text, and workplace reefer madness no less, with Ernie Smith, black male, talking about how he and Joey 22 consumed cannabis on the job. Talked about over and over, probably get even more of that as we get closer to the trial, but we'll be here tomorrow for the book club, normal time, 8 p.m. Eastern, 5 p.m. Pacific. Looking forward to it. Double duty, tough day. Joey 22, we did our double duty today, hopefully constructive. If anything, I think she said it best, like, hey, I don't think this should be a reason to be locking up black people. Cannabis, no. But I'm not going to sit here and whoopee recreational cannabis, and that is going to be great for black people. Like, no, I did not think that 10 years ago. I do not think that now in any way, shape, form. Hopefully we'll be able to get, as I said, some of the folks who've looked at even, hey, is this helping to keep a lot of black people out of prison? Or do we just have all this, kooky products, Fruity Pebbles and all the rest of it, to make individuals classified as white a lot of money? And then, hey, even if you don't have a whole lot of folks going crazy and all the rest of it, do I think this is going to be best to having a greater number of pregnant black mothers, non-white mothers using cannabis during pregnancy? Do I think it's going to be constructive to have a greater number of middle school, 13, 12-year-old, 14-year-old black children using cannabis? Does that sound like we're moving in the direction of universal woman, universal man? I'm going to say no. You can think on that one, come to your own conclusions. Again, we'll be here tomorrow. Book Club, 8 p.m. Eastern, 5 p.m. Pacific. Thursday, neutralizing workplace racism. And Saturday, compensatory call-in, 9 p.m. Eastern, 6 p.m. Pacific. Pulling tough days, or I guess at least a long week in the middle of the summer. Today was like the warmest day in the calendar year 2022 here in Seattle. It was like 82 here today at the warmest part of the day, I believe. I don't believe we've had any days that have been that warm this year. I think we're supposed to have even a few days of warm weather. Oh, it didn't quite get to 82, but it was at least 80 today. So very warm. It was, kind of bittersweet. At least I got to sit outside and enjoy the sunshine. Anywho, much obliged for folks tuning in. We didn't miss anybody. Everybody commented who needed to. Grant. If you missed out, you can save it till this weekend. The Grandcester, Dr. Francis Cress Welsing, trying to have us getting in the correct direction, also pointed towards universal woman, universal man, wanted our brain computers working to their best, their greatest capacity. We will solve this problem. Talking even that when she gave her response in her 20th visit, she was talking to a retired firefighter there. I think his offspring was present. She said, hey, sobriety, stay away from alcohol and drugs. Mention them both. Not going to help us solve any problems, not taking us the direction we need to go. With that, sobriety would be best. Can't be emphasized enough. They had old Dr. Dre and Snoop at the Super Bowl this past year, down in California, no less. They didn't do Express Yourself. If they did, I missed it, where he said, I don't smoke weed or cess. Did they do that one? I don't remember if they did that one. Chronic this and chronic that and all the rest of it. Anywho, If you're out and about, this is not the time for confrontations with strangers. I would be all about exiting. Someone is being rowdy and hostile in public. If you're in a vehicle, you are sober, you are buckled up, you are not on a mobile device. We want all of our attention, and we want to do the small things that we can to minimize contact with race soldiers, badge or no. That said, Creator, we ask that you help us remain patient with other black people, victims of white supremacy. We ask that you help us remain patient with ourselves. Remind us to demonstrate the highest levels of black self-respect at all times, in all places, each and every time we are in contact with another black person. It has been time. Replace white supremacy with justice immediately. Cow signing out. Thanks all for tuning in.